like we have quite a few people coming on, so we'll give it a few more minutes before we get started.
Hello?
Hello, this is Diane.
Hi, Diane. This is Demita from Blue Mountain Counseling.
Hi, Demita. We're going to get started here in a few minutes.
Okay, I'm just going to put you on mute.
Okay, sounds good. Hey, Chelsea, can you put the slide, housekeeping slide?
Yes, I will. Just a second.
Thank you. I'm not sure. Did I get on before you? Because I think
you did, because I signed into the other one.
Oh, sorry. That's okay.
No, it's okay.
I'll push record, and then
I'm recording already, so it allows me to record even though I wasn't the first one here. But you're the presenter right now, so I'm going to steal the screen so I can put the housekeeping up, and then we can switch back over to you. Does that sound good?
Yep, sounds good.
Yeah, you can look at that one. If he's not here, he's in the supervisor already. Oh, wait. Right there. Okay.
Diane, this is Carol. Can you hear me?
Hey, Carol, this is Martin. I can hear you.
Okay, thanks.
Yeah, I can hear you. Sorry, I was talking. I was on mute.
I've muted myself now. Thank you.
That's great. I was trying to see if Teresa from Healthcare Authority or somebody from Healthcare Authority was on.
Hi, this is Ruth Leonard from Healthcare Authority. I'm assuming Teresa will pop on here in a few minutes.
Okay. That's what I was waiting for, to see if somebody was on. I know she had answered some of the questions already, and so I just wanted to make sure she was on before we got started.
I'll send her.
In the Siri guide, it's on page 119. So the GT modifier is used for the other telehealth, such as FaceTime or other technologies usually not considered for telemedicine. CR is the modifier is used. So we'll go ahead and I will open up this real quick. So I also attached these PDFs to the meeting invite. So that way you have to put the links or whatever. So I'll go ahead and open some of these up. I'm not sure which one is which, but we will find out in a second. Oh, here we go. So these are the policy on the billing through this COVID-19. And everybody has this available for them. It has quite a few questions on how to do the billing, what is required, and so I think that then it has the codes at the bottom of it and the modifiers as well. So this is a really good handout for you guys for your information. But if you have any other questions, we can discuss those. So does anybody have any questions before we move on to the next set of questions? I think that modifier, that frequently asked questions is a really good starting place for people, for the behavioral health providers, and answers a lot of questions that have been coming into Healthcare Authority.
Hey, Diane.
Yes.
Hi, it's Teresa Claycamp from Healthcare Authority. Yes, I'm sorry I was delayed from another meeting, and so I just jumped on and also just wanted to stress that Gail Krieger, who is the main author of this document, she is updating it from time to time as questions come in, especially through the Tuesday webinars that we're having with providers, as well as the DBHR COVID inbox. So she's updating the FAQ, and so we do encourage folks to try to grab it off the website when they're looking at it, just to make sure they're looking at the current version. I hate for anybody to miss anything, but it is pretty detailed, and it talks very specifically about if you're a provider using the Siri guide versus another type of provider, and kind of some of the details about coding and billing.
Yeah, and that's why the link is included in this agenda. I think that's great, because even when we are going to talk about, we created a little link as well, a little resource guide for this COVID-19 as well. And the most current version is on our website as well. So I think that's the best bet, is if you have any questions, is to definitely get it off the Healthcare Authority's website, because I'm sure that it's updated regularly. So did anybody else have any other questions on that before we move on? the number 2 question is included in that, in the same, the number 2 question is answered as well. That's that frequently asked questions that's just been released. So for the question number 3, it says, currently there are inpatient providers that are unable to take patients because of the active COVID-19 cases in their facility. How can we get this information, and who is not accepting the patients? So a healthcare authority has begun sharing a public-facing document, and let's see if I can click to it here. Oh, of course not. I'm not sure why it's not working, but I also did add it to here, and that is on here. Hold on. And it's a list. Do you want to say something about this, Teresa?
Yeah, so we very quickly, we're getting lots of notifications from providers, as well as from our MCO and ASO partners about just various changes in the network. So we have tried to keep track. We are partnering with the Recovery Helpline, which is the 24-hour recovery helpline as well, in our state, because they're also hearing from providers. And so we're gathering information from them. We are definitely gathering updates from the MCOs and ASOs if they're also proactively kind of getting a sense of what's happening with their network. And these are really, it's more about like closures, partial closures, changes in admission practices, things along those lines that are impacting providers in the immediate, situation. And so, it's as accurate as we can get it. And so if you see something inaccurate on there, please, you can email the COVID inbox, the DBHR COVID inbox, and say, something like update to provider impact list or something like that on the subject line. And we have staff that are dedicated to updating this daily to try to make it as, in real time as possible, but it's a chore, it's a lot. So, and I know it's a little, I hope, one of the things I had provided feedback to communications was I really wish this could be sorted by county. So I hope, from your standpoint, you can, I don't know if you can do that once you pull it off, or do you have to like pull it off and save as, and transfer it into, okay. Because that obviously,
pull it off,
right?
Put it because it pulls off as a PDF.
Okay. Are you able then to just extract it and put it into Excel and then sort it by county, or no? I'm just curious.
Most likely not, unless you have the extended, or you might be able to copy and paste it into Excel. I haven't tried that.
That's one of the things I've been wanting to get feedback on, is because I looked at this and went, gosh, wouldn't you want to be able to sort it by county usually?
That would be the best way, because then people can go to their specific county. If there's any way that healthcare authority could do that, that would be awesome, because I think right now it would sort it, put it in Excel and then sort it.
Okay, I'll work with them on that. And yeah, I can see somebody in the chat box that is saying that yes, every Tuesday DBHR is hosting a webinar from noon to 1:30, and these are some of the questions and concerns that we addressed during that time. So
yeah, and that's what I was going to tell her. Those meetings are very helpful, and if anybody needs the invite or whatever, they can reach out to me. I can forward it on. And then so I had a question about this. So I know that we don't have a lot of inpatient in our location. I know that we have Sundown Ranch. So I was going to ask Mark, how are you guys handling your, have you guys had any positive cases in your facility, or are you guys how are you handling the admissions for you guys?
Hi, this is Mark. Can you hear me?
Yep.
Okay, good. We have not had any positive cases, and we're screening like a lot. So both over the phone, and then our gates close 24/7, so you can't get through the gate unless you pass the screen. So even patients may have passed the screen over the phone. They're going to get screened again before they're admitted. And so far, that's worked out pretty effectively.
Are you guys allowing visitors still, or how are you guys monitoring that?
No visiting, no family counseling currently.
Okay.
Yeah, pretty much on lockdown. Patients and staff are all wearing masks.
Okay. Well, that's great. I'm glad you guys don't have any positive cases. That's really great. So how about Triumph? I know that they, maybe they could give us a little update on what they're doing. I know Tom just said something in the chat box, but let me see if he can.
Yeah, this is Tom Davidson. Can everybody hear me?
Yep.
We, as you guys, I think most people know, the week of the 24th, we actually suspended admissions. We're currently working towards developing a plan for starting to take admissions. We still have patients, although our numbers are rapidly dwindling in our intensive inpatient programs. Our PPW programs are still pretty active in terms of our numbers, although they're all down. We too have not had any positive patients. We also are doing screening similar to what Mark described. We're doing regular screening of our staff. If we have any indications of symptoms or anything like that with patients, we are screening, and pending results of any tests, we're isolating and trying to follow all the protocols and directions that we've been given by the local health district and Department of Health. Our greatest hope is that we can get ourselves in position where we're able to start opening it up again, because we know the need is out there. And so that's really our primary focus right now, is what do we need to do next to make sure that we have got everything we need to be able to manage the potential, the very likely potential at some point that we will have patients who are positive. One of the challenges that we've had is we cannot get PPE. We are working with all the people. We've been directed by Department of Health, by the local health district, but we cannot get, we've ordered shipments of masks and so on, and we just are running out of stuff. And so one of the conditions we really have to have in place is making sure we have enough personal protective equipment for patients and staff should we have patients who are positive. Plus, we want to mitigate the risk as much as possible. We too have everybody sort of running around with masks on. That's it from a residential standpoint.
Do you guys have any positive cases at this time, or not at
No.
this time?
We do not have any positive patients. We have not, I don't know how we've managed. You know, we had a couple of exposures that we were informed about. And there's always the potential that somebody has left the program against advice or something like that, who has later tested positive, but we have not been informed of any. And we've had nobody that's been in our program that has tested positive.
Okay, that's great. Did anybody
Unfortunately, we did have staff. We had a number of staff who tested positive early, and that was part of our part of what contributed to our decision making, is that we were hit pretty hard early in this process with staff who actually had symptoms and tested positive. And so we had a lot of fear, a lot of anxiety, a lot of struggles with making sure we had adequate staffing to meet, patient needs. And so that's sort of what precipitated our decisions that we made at that point. All of that is actually settled down. As it turns out, we've probably had 25 staff who've actually tested, and out of 25, we've only had 5 that tested positive, and I think most of them are either back at work or preparing to come back to work.
Okay. Did anybody have any other questions about the inpatient or the residential facilities that are in our area? I don't know. I know Lourdes has an inpatient, I think, I'm pretty sure they have a small inpatient. Is that correct?
This is Dana. Can you hear me?
Hi, Dana.
Hi. Yeah, we've got a 20-bed inpatient hospital, and we're staying pretty busy. Our census really has not dropped down. We're still, taking people in, also for our RTF transition. But everybody's wearing masks, staff and patients, and we are screening before they come in and screening when they come to the facility, and no visitors.
Okay, great. Sounds like everybody's doing what they need to be doing. Does anybody have any questions on this, or can we move to the next question? All right, so we'll just move on. So the next question is there is access to smartphone using Lifeline program. In fact, before I preface this, I just got an email from Kat Latte from CHPW, and I will forward that out to everybody. It is about these phones, and they are going to be giving I could show you the email so you can see, but they're going to be giving out cell phones to patients that have Medicaid. And so here, I will pull that up real quick, because right now they're going to extend it to unlimited until this COVID is done. And I don't know if there's somebody from CHPW that wants to talk about it, but it's called the Stay Connected with Free Cell Phone Plan. And so then it talks about, there's no cost to them. And then this is how they acquire them. They call the number. And right now, the additional benefit is that they're giving them unlimited domestic calling and texting plans and through 520, and then if you do the Safe Link, it's through 429. But these are the way that you can get them. I'm not sure. Are the other plans, maybe Melina and Coordinated Care and AmeriGroup, talk about if you guys are doing something similar to this for your patients as well?
Teresa, this is Courtney with AmeriGroup. I sent you the flyers that we offer through AmeriGroup, so if you need me to resend those, let me know.
Yeah, I actually did, and I did forward those out to everybody. And so yeah, I did do that. I just got cats today, and so I totally spaced it. I did send out AmeriGroup out to you guys last week when Courtney sent it over. And theirs is right here. So very similar, and has all the information for your customers or your patients. Did Melina and Coordinated Care, did you guys have the same similar thing?
Yes, benefit. This is Melina.
Is there a way you can forward that to me, and I can forward it out to the providers?
Yep, I will get it forwarded out in just a couple minutes as soon as I find it in my email.
Okay, great. That's great. How about coordinated care? I don't know. There's somebody.
This is Jessie for coordinated care. Can you hear me?
Yep.
Okay. I do not have the flyer right now, but I will reach out to that department and then I will get it sent over to you.
Okay, perfect. Thank you. So that's pretty much the other question is are these phones that are giving, are they going to be able for the patients to be able to access Zoom or any other kind of telepresence platforms or that? I know that GCACH has provided up to $6,000 to each of the organizations to help with their purchasing of equipment for telehealth, and so I'm not sure on the smartphones that the programs that the Medicaid programs at. Do you know if they have Zoom or are able to use that for them?
This is Corey from Molina. And I checked with our member engagement specialist on these, and she says that they do have, I mean, they have data and that they should be able to download apps. So I think that they should be able to use it. You know, of course, I say this without being able to confirm it myself firsthand, but it sounds like they do have functionality to download an app and have data.
Okay, great. That's a big help. I know that right now with the telemedicine that you guys can contact them by cell phone as well, and it doesn't have to be face-to-face, but I know that in the future that's probably going to change. But so anyways, does any of the providers have any other questions about this question?
Diane, this is Teresa from Healthcare Authority. I just also want to chime in. So for clients that don't have, you know, they're not assigned, maybe they're uninsured, okay, and don't have access to a possible option through their healthcare plan. I do know that leadership is looking at trying to deploy, you know, come up with laptops and phones for providers during this time. I know they're looking at that and had wondered, yes, during the webinar yesterday, I had kind of wanted to kind of find out from providers about the scope. So if, you know, and the scope of the need. So if providers had access to, you know, if we could deploy some laptops and some cell phones, what would the need be, kind of thing. So I know they were kind of wanting that information. I get a sense. So something to think about. It's just something we're very aware that during this time, you know, if a client doesn't have a phone in the very least, it's going to be really hard to stay connected to services. So
exactly, and that I just sent out a message to each of the providers asking them if they needed any computers, because Carol actually was contacted, the executive directors were contacted in their meeting for us to reach out to our providers to see if anybody needed any additional laptops that they could lend to the providers to get through this. And so I only had four of the providers reach out to me saying that they needed some laptops. And so if any of you are still thinking that this might be something that you want to receive, could you please contact me as soon as possible so that we can let Michael at Healthcare Authority know, because I know that they want to try to get this pinned down so that they have enough to be able to send out to the providers if they need them. So we can go on to the next question. And the next question says, what can we do as providers to support clients that are most at risk and divert them when possible to the ED and other crisis services during this pandemic? You know, I don't know if maybe MCOs want to chime in, or if any of the providers want to chime into this question.
This is Misty with Molina. I think, you know, education's a big piece, and each of the MCOs have their own things that they can offer. So with Molina, we have a virtual urgent care, and I think we have a lot of different things going on in communities in terms of where the best alternative for their care is going to be. And we all know that the now telehealth and telemedicine is being paid for in this crisis. So I think we need to really make sure that we are educating ourselves as well as our members to how they can go about that, and really reaching out to people beforehand to, you know, when appropriate, and getting the word out there on how they can access those services.
Great. I'm not sure. I'm not sure if any of the ASOs are on. Anybody from the ASO is on the phone. Let me see if I look here real quick. But I am curious as to, you know, how are the crisis services? Maybe even the crisis providers can chime into this question. But my question is how is the crisis services being handled right now? Are patients? Are you seeing that there are more patients are in crisis more, or are all the crisis calls being handled okay?
Hi, Diane. This is Cindy from Greater Columbia ASO. And I can't speak for the providers, but I can give just a brief update of the information we're getting from the ASO in regards to this. All of our providers are still performing full services. The DCRs are still evaluating. Some providers are using telemed more than others. Some are still doing everything face-to-face. The crisis numbers, the crisis calls that we've had coming into the ASO, we have not really seen an increase in crisis calls. They've pretty much stabilized. Some of our providers have reported that ITA evaluations may have dropped just a little bit. ITA detentions might have dropped a little bit, and it sounded like the primary reason for that was that there's no beds available. A lot of hospitals are really trying to save beds for COVID situations. But I don't have small details about that. So if any of the providers are on the phone, they might fill in the blanks. But so far what I've heard is that things are going well. Everyone's providing all the same services. We do have a touch base on Thursday afternoon with our crisis providers with these exact questions of how are you providing services? Do you have the electronics that you need to do telemed or to do video conferencing? So I haven't heard anything is going awry, or that there's anything missing, or that there's any gaps in the crisis services at all.
Thank you for that update, Cindy. I really appreciate that. Did any of the providers want to chime in at all, or does anybody have any questions about that they want answered? Well, that's great. So I guess it sounds like that everything is going well for that. I'm glad that it doesn't seem to be affecting the crisis services that is provided in our region, which is really great. So this is just a fact sheet that is also available And it talks about the integrated managed care, behavioral health provider support during COVID. And it talks about, so I'll let you guys read it, but it talks about what healthcare authority and MCOs will take to support the BH providers. And then it also talks about like what the provider actions are. And so I think this is another good resource for you guys to have. If you have any questions about that, you can, does anybody have any questions regarding this? Okay, so that's kind of all I have for today. I wanted to give the providers a chance to kind of maybe they want to tell us what, how telemedicine is going for them. Is there anybody that wants to talk about how the telemed's going, and are you guys having any issues or problems with it? Is there anything that we can do to help mitigate this situation right now? So those are kind of some questions. And so I'll let you guys kind of talk and let me know how things are going. So I need to call on some providers. Come on, don't all. All right. Well, let's see. I'm just going to call him. I know Penny's on the phone. Maybe Penny can tell us how things are going with Ideal Balance.
Oh, actually, I was on the call. CHPW had a call yesterday, and I did the same thing to me. But Tele's going really well. At first what we did was the clinicians, separated, and they're in a different building in their own offices, and they were doing Tele where the originating site and the distant site were still clinics. And then now we are shifting where half of the clinicians are at home and the patients are slowly moving home. We're finding a lot of the patients don't have phones, so we're getting that set up. But we've got to get the laptops I need for the clinicians, the ones that are still in the office, to be able to go home. But no, it's going really well. We had been doing telehealth before, though. We were just doing it from like Kennewick to Everett. And now it's just shifting where they're at home and remoting into their computer at work. So to me, we're doing the exact same thing. We're just not seeing a person in person. It's cut down on paperwork significantly because we're getting everything verbal, and that's all charted, the verbal consents for third-party payer and consent for the tele. And we're doing true tele, which we're using the Zoom, which we'd already been doing. There are some phone things that we're doing for clients that don't have a smartphone that we're able to do the phone stuff. So, but no, it's going pretty well. It's getting the dots connected where the client calls in, then they get connected into a Zoom room and then connected to the clinician. But we haven't really seen a drop in services though, so that's good.
Well, that's good.
Yeah.
Great. Thank you, Penny.
Sure.
Hey, Diane, this is Cindy. Can I ask Penny a question?
Hey, Cindy, I heard your voice.
Okay. Penny, I just was curious. You mentioned for consumers who might not have cell phones. Have you guys accessed any of the cell phones that the MCOs are offering for consumers yet?
We are in the process of doing that right now. We've got the word out. We've got a marketing team, so we're really trying to, but we haven't. I'd have to ask like Ideal Options if they're doing it as well. So, but I know we're connecting the dots with the clients because I have the flyer, the CHPW that you just showed, Diane, and then I've been on the HCA calls, the DBHR calls, so I've got all the information. But we didn't realize it in the clients. I think we thought the clients had smartphones when they didn't. And to utilize Zoom, you're going to need a smartphone. Just a typical phone doesn't work. So we're working on it, though.
Well, that's great to hear. I haven't heard of anyone else doing that yet.
Yeah, that's what I was just going to ask you. Has any of the providers have clients that have the cell phone through this? I guess not. Okay.
Nice.
Okay, so I hope that all the other providers are going to take advantage of that for the cell phone, that for your clients, and that way they can keep in touch by that. My other question, I had a question for Teresa. So Teresa, how is the Zoom account for the providers? Do you still have Zoom accounts that providers can still get?
Yeah, so so you're asking about the Zoom licenses that we're deploying for folks?
Yes.
Yeah, so I would encourage folks, we did have a limited number, but a high amount of number, I mean, really, because we weren't quite sure how to scope it, and essentially solicited folks to apply for those. They are for individual clinicians, there was pros and cons. It's not for an actual agency, it's actually for each individual clinician. So if an agency is interested, you would send in the application for each of the clinicians that you want to have signed up, and then you hear back within 4 days if you're going to get it. And for the most part, it's worked really well. They go ahead and get, we also have some staff too that if there's some technical assistance needed in trying to get that set up, when you get your email that you've been given, basically here's your Zoom license, then there's steps you have to take to get that going. And if you have some issues, there's a way to get some technical assistance. And so I would encourage, if folks are still interested in those Zoom licenses, to go ahead and keep sending in the applications. I don't think we've reached our maximum.
Okay, great. That's what I was wondering. I know that there are some providers that with GCACH that have utilized that, and I believe that they're really grateful for it. Thank you for providing those for them.
Yeah, and I do want to stress, I know there's been some concern. I do want to stress that there's been concern about the security of that Zoom. Lots of publicity, and I understand from our team that it's the telehealth or the healthcare platform version of Zoom, which has a lot more security measures to it. And so just want to point that out, because I think there's been, in the last week or so, there's been some concerns about Zoom's security issues with people hacking, and the platform we are purchasing and providing is the one that's got the extra security measures to it.
It's the Zoom Healthcare. It has a lot more security on it than just the regular Zoom.
Hey, Diane, just a quick question. This is Chris Villeneuve. One of the things we've noticed with Zoom is that there's a 40-minute time limit when you have more than 2 people on. Is that being addressed?
Let's go. Teresa, do you know if that, or is that something you'd have to ask your team about?
I can ask my team about that. Is that with the healthcare platform then?
Yes, it's with the individual accounts. We've seen it come up with our counselors. So one of the challenges is that we've had our reception staff do scheduling, and that if there's more than 2 people like on the call, that it limits them to like a 40-minute session.
Oh. Okay. Let me pop that over to the team and see if they can answer that.
This is Tom Davidson. Has anybody else had that issue? Because we've not run into that in our outpatient center or our outpatient program.
So when you have more than 2 people on, I'm not really understanding, is there a receptionist, a clinician, and a client on the Zoom?
Yeah, so let me explain. So when we do our centralized scheduling, so the reception staff will set up the appointment, and then they're able to send out the reminder to clients. The client can access the appointment, and the clinician access the appointment, and the reception staff drop off the call. But it makes sure that everybody's on the call, and that way we're keeping centralized scheduling going. Does that make sense?
It does, because I know the free version has a 40-minute limit, but they release that if you install a little EXE thing, but that's a limitation on the free version.
Yeah.
Not the licensed version.
Yeah, and I just got a text from Angelica, our client services manager, saying that the licensed version doesn't do that. So.
Right. It's just the free one that does that. Yeah.
Yeah.
Yeah, that's what I was going to say too, Penny.
But my understanding is Zoom released an EXE so that if you use the free version and you install that EXE, it releases it. It takes that 40-minute cap off. And I've just heard that from school teachers that were using the free, and then they install that EXE to get that off.
It is recommended that you use the health one though, because it is HIPAA compliant and all that.
Correct. If you don't have that one, you can use free until you get it, but absolutely you want to use the one that's made for tele.
Yeah, definitely want to use that for you guys.
So can I, this Teresa, just make sure I'm following up. So the person that had the original question is, do you have the healthcare platform version? And if not, are you, maybe I would just encourage you to go ahead and apply through the Healthcare Authority Zoom. Say that again?
Yes. Yeah, this is Christian. Yes, we have the healthcare platform one.
Oh, okay. And you're still getting that 40-minute limit. Okay. I'll kick it over to Steve. Weird.
It's probably something that, like Teddy was saying, you probably have to download something.
Yeah.
Well, you don't have to do that for the licensed version. What my first thought would be, you have the licensed version, but the license isn't connected to your Zoom, so your system is connected to the free version. So there's some connection that has.
Yeah, it's something to do with the basic account, and IT fixed it. So, thank you.
Perfect. Great. Did you have any, Chris, I know you kind of got on a little bit later. Did you have any other questions that, I know you were the one who sent these questions, but we will send out the meeting minutes for you. But did you have any other specific questions that you wanted answered while we have everybody on the phone?
Let me check with Angelica. Angelica's on the line right now. She's our client services manager. And Angelica, is there anything regarding billing that we still have questions about? I think just knowing that the MCOs are ready to receive our encounters and that we're in process with it is going to be our first check.
Right. So yes, we have. I think one of the things that we ran into is, even as recently as this morning, we had one of the MCOs reach out and say that they are not ready to actually receive our claims with the CR modifiers on the back. So just getting a better understanding of when we can start submitting claims to the MCOs would be greatly appreciated.
Does any of the MCOs want to chime in about that? Let them know when they're going to be able to submit their claims with the modifier on it?
For coordinated care, we're ready to receive them now.
Okay, great.
Same with AmeriGroup.
And this is Corey with Melina. My understanding is that we are ready now, but if you're hearing that from Melina, feel free to let me know, and I'll double check on that.
So which one was it that you had that come from, Angelica?
It was a meeting with AmeriGroup.
Oh, AmeriGroup. Okay.
So yeah, the rep let us know that their system was not configured at this point to process any of our claims with the CR modifier.
Courtney, did you want to bring that back to your team and ask them about that?
Yeah, because we had to do a national edit for COVID, and this was escalated. So I'll triple check.
Okay, thank you. What about
HPW?
Hi, Diane. This is Joel, and it's also my understanding that we're ready to receive data.
Okay, great. Has any of the providers had any issues with things so far with the telehealth and with the MCOs at all?
It's just, hey, this is Christopher Miller again. One of the things that we're coming up against is an equity issue that, you know, even though that some clients are able to get smartphones, it's not the same when trying to provide therapy services. That we noticed an equity difference for clients that have typically have private insurance or commercial insurance. They've got access to laptops, desktops, cameras. We're able to schedule Zoom, but the problem really is for our clients with lower incomes or no incomes that having access to consistent communication is really limited. So one of the things that we've done is use some of the funding that is coming from GCACH, which we are very grateful for, to be able to purchase laptops, Chromebooks in particular, and use hotspots that we'll be able to set up some Zoom accounts with. So we're going to be working on that over the next week or two, but that's really only going to be a small number of clients that we're going to be able to provide that for. We've been really closely monitoring how many of our clients have access to secure communication in general, and we're looking at something like 50% or less have consistent secure communication that they're able to use. So
what about
oh, go ahead.
Have you utilized the cell phone thing? You were kind of not on the line when we talked about it, but all of the plans have the safe link, that the smartphones that they can get through the state. Have you utilized it yet?
No, that's one of the things that we're looking at. We're trying to figure out how many clients have access to them. One of the things we've come up against is that if their address has been used previously, then they're not able to access the cell phone service. And having the right cell phone based upon zip code and stuff is important. So we're looking into it. We've kind of we've went to 100% telepresence as of like the 19th of last month, and that's made a huge difference for us. But we've noticed the real equity issues around who has access to Zoom or to being able to just have consistent communication. So it's something we're still trying to address.
So, you know, I sent the email about those computers. You can use those computers for that as well. So maybe people might want to send me an update that maybe they do want to access some of those computers that the Healthcare Authority is going to loan. If you are, you can reach out to me.
Yeah, I think that it's a great option if they were going to be used in clinic. Our concern is that if we're going to use those with clients, that the likelihood is we're not going to get those back. So we think that purchasing low-cost Chromebooks is going to be a much better option because we can provision them with applications, lock them down onto what they're able to utilize, create secure communication channels between us and the clients. But using the laptops, we wouldn't have that ability. So, and the concern is that if we had to return them, that the likelihood is we're not going to get them back. So we'd rather be out $150 for a Chromebook than to get a loaner from the state where we're not going to be able to return.
Gotcha. That makes sense.
And Teresa, this is Courtney. Or, I'm sorry, Teresa, I did it in the chat too. Diane. Sorry, Diane. I just hear Teresa's voice a lot lately on these calls. AmeriGroup is configured for the CR modifier. We have always been configured with that modifier as we use it across multiple markets. So if the provider who indicated that would, we can reach out to you and clarify that. So yeah, but we're all set.
Angelica, if you wanted to copy Courtney on that message that you received saying that they're not able, maybe she can, maybe you guys can talk offline about it.
Perfect, thank you.
Mm-hmm. Okay, I think that's all that I have for today.
Diane, well,
yes.
You can ask a question to the providers. So when I've been reaching out to providers, and one of the providers mentioned that regarding telehealth, when dealing with the monolingual Spanish-speaking clients, some of the clients are unable or unwilling to use telehealth services, and wondering if other providers are experiencing the same issues, and if so, if they come up with a solution. Because, like I said, I know that some of them are not either unwilling because they're not able to, or just they don't want to receive services that way. So again, just want to see if I can get a response to that.
So the question, Joel, is that the Spanish-speaking clients are having issues with the telehealth. They are feeling that are they feeling that they're not being able to do it, or that the providers just don't have a way to do their call because they are the Spanish speaking? Is that the issue?
No, yes. I believe it's just unable to do it. Maybe they're not. They don't have the technical expertise to work the download the applications so there's an application, or do the work the smartphones.
Just hey, Diane, this is Christian Olney again. Hey, just a quick thing. One of the things that we found is that when we initially moved all of our staff to telehealth, that staff were ready, clients weren't. As soon as we started calling them and then telling them that we were going to be contacting them, staff were going to contact them through cell phones and other things, that about 50% of the clients immediately lost contact because they didn't recognize the phone numbers. So that's one of the problems we had. We had to go back, reach out to clients separately from a recognized number, and be able to tell them you're going to get a phone call from our central phone, and that you'll see that recognized number, and that helped. But it's still, everything seems to be a work in progress. That getting the clients to engage, that one, getting them to engage on the phone is a change in the way that we've communicated in the past. Getting them to use video conferencing is an even bigger change, because a lot of clients that we're working with have had contact with CPS in the past and have brought up issues around privacy, that they're worried that us seeing them in their homes is going to be kind of used against them and pull in CPS and other, services that they're hesitant to engage in. So it's a lot of education that's been going on and just trying to work with clients to educate them about this new reality.
I would just echo that sentiment exactly. We found ourselves at Triumph having to educate a lot of people. We've also tried to find workarounds. We've learned about free internet access that we've been able to turn patients onto because some of them had very limited time and they were reluctant to use their time because they had other priorities in their life. So we've been able to give them information about that. We actually extended our Wi-Fi so that people, if they wanted to, they could just come close to our building and communicate with their counselor. We also set up an annex with an office area and a PC that if they did not have the ability to use their phone or have a computer, they could sit in this office and have their conference or their individual session or group or whatever with our counselor. So I think that what I've been hearing is very similar to what I just heard, which is people are finding ways to make sure to educate patients and find workarounds.
Are anybody having issues with their Spanish-speaking clients and not being able to translate or not being able to have appointments because of the translation problem?
I've not heard anything from our Spanish-speaking staff that's been an issue.
And Diane, this is Teresa. I just there was a change with our interpreter services, just for folks to know pretty recently that the vendor that we use for interpreter services is actually now doing phone interpreter services and telehealth interpreter services. I heard from, I've been on so many provider calls, so I can't remember which one it was. It was yesterday, where a provider had done interpreter services, had utilized interpreter services via telehealth for the first time. She said that it worked really well, but she found that when the interpreter turned off his camera, that actually was better. It seemed to work better, so that neither her or the client was kind of distracted by the interpreter's camera, and it was more just an interaction between them themselves. So I thought that was the interesting tidbit. So anyway, I just sent some update to you via email on that we did alter the contract with the vendor Universal to be more nimble during this time due to all the telehealth that's happening.
Okay, I can send that. I saw that it just came through, so I'll send that out to the providers so that they have that. But that's a great information about the webcam and having the interpreter turn it off. That's probably helpful. Thank you for sharing that. Okay, well, I think that's all I have for today. Does anybody else have anything that they want to talk about while we're on the phone?
Hey, Diane, this is Mark. Just want to say thanks for the resources for the telemed. I mean, the turnaround time on the funding was really quick, and just appreciate Carol and the board providing that funding to us.
Yes, we're glad that to help. We really have wanted to help our providers through this. And so I know Carol's on the phone. I don't know if she wanted to say anything. So I guess maybe she's on mute and she doesn't know. But anyways, I just wanted to tell you guys we really appreciate you guys the work that you're doing. And, you know, I know that this is a challenging time for you guys, but I'm hoping that if you have any questions or concerns that you guys will reach out to us so that we can make this this challenging time a little bit more not difficult for you guys to get through, and that we're here for you guys if you need anything. So thank you so much for your time today, and we will send out the minutes as soon as we get them, but I also will send out those emails that Teresa has sent, and I really appreciate you guys. I hope you guys have a great day.
Thank you.
Thank you.
Thank you.
Be safe, everyone.
Yeah, stay safe.
Thanks, Diane.
Thank you. Bye-bye.
Bye-bye.